Hey guys, in this video we will discuss about infectious mononucleosis. Infectious mononucleosis is also known as glandular fever. It is caused by Epstein Barr virus, which is previously known as gamma herpes virus 4. This virus spread by saliva, most commonly through kissing, and this is why this disease is prevalent mostly among the teenagers. Now, let's go through the clinical features of infectious mononucleosis. First, the incubation period is between 1 to 2 months. We will divide the symptoms that appear into early syndrome and late syndrome. The first symptom to appear are fever, headache, and malaise. The fever normally resolves within 2 weeks, while the malaise settles over few weeks. The next syndrome to appear after these three is severe pharyngitis, which characterized by first tonsillar exudate and second non-tender anterior and posterior cervical lymphadenopathy. Here in this diagram, it is shown the location of anterior cervical lymph node and posterior cervical lymph node. Well, until now we know that Epstein-Barr virus causes infectious mononucleosis. However, there are many other microorganisms that can cause infectious mononucleosis, mostly viruses though. They are cytomegalovirus, human herpes virus 6 or 7, HIV primary infection, and toxoplasmosis. Coming to the complication of IM, we can divide it into common, uncommon, and rare. The common complication of IM are pharyngeal edema, which is the swelling of the pharyngeal tissue. It can cause airway obstruction if left untreated. Antibiotic rash can occur when patients with IM take amoxicillin or ampicillin. Prolonged fatigue, hepatitis, and jaundice are the other common complication of IM. Some uncommon complications of IM involve neurological, hematological, renal, and cardiac system. In the neurological complication, we might see cranial nerve palsy, polyneuritis, and meningoencephalitis. Well, in the hematological, the complications that we can see are hemolytic anemia and thrombocytopenia. Abnormal urinalysis and interstitial nephritis are the renal complication of IM, and on the other hand, myocarditis, pericarditis, and ECG abnormality are the cardiac complication of IM. Some rare complications that can occur in infectious mononucleosis are ruptured spleen, respiratory obstruction, which is caused by pharyngeal edema, as we have discussed before, granulocytosis, which is severe low absolute neutrophil count, which is less than 100 cells per microliter. Interestingly, Epstein-Barr virus not only causes IM, but it can also cause malignancy. So the malignancy that Epstein-Barr virus caused are Burkitt's lymphoma, Hodgkin lymphoma, and nasopharyngeal carcinoma. So there are some investigation that can be done to diagnose infectious mononucleosis. The presence of atypical lymphocytes is probably the earliest indication of Epstein-Barr virus infection. However, it is not specific to EBV infection. Atypical lymphocyte can also occur in acute retrovirus syndrome, which occurs in HIV infection, viral hepatitis, mumps, and rubella. Next, the test that can be done is Paul Banal or monospot test. It detects the heterophile antibody. However, many children and almost 10% of the adolescents do not produce this antibody, which makes this test less accurate. Therefore, Epstein-Barr virus serology is the only way to confirm the diagnosis. The management of infectious mononucleosis is basically symptomatic. If the throat culture show beta hemolytic bacteria, then we need to give penicillin. However, keep in mind that ampicillin and amoxicillin cause antibiotic rash in Epstein-Barr virus infection. When the pharyngeal edema is severe, glucocorticoids is given. Normally, prednisolone 30 mg daily for 5 days is prescribed. Thank you for watching.